Hello and welcome, everybody. Thanks for taking the time to join today. I'm excited to go over the Medicare program, clear some misunderstandings up, and hopefully answer some questions that you may have. But before we get started, let me introduce myself. My name is Lauren, and I'm a licensed broker, which means I work with multiple big name carriers to help provide you different plan options. I look at people's medications, doctors, and lifestyle to find the most beneficial fit for them. Of course, there's never any cost for my service, and we can always meet over the phone, virtually, or in person. I like to make things as comfortable for you and I both. I represent a company called Empower Brokerage, based out of Southlake. Nationally, Empower Brokerage represents over 100 carriers. They have a national call center with bilingual support and brokers all across the country who are dedicated to working closely with Medicare recipients and healthcare providers. All right. So, in this presentation, we will go over what is Medicare, what does it cover, when to enroll, how much does it cost, and are there other options? So, what is Medicare? Well, it's a government health insurance program and it serves three groups of people. It serves people over the age of 65, people under 65 with certain disabilities, and people of any age with end stage renal disease. Medicare is administered by the Centers for Medicare and Medicaid Services, which is also referred to as CMS. It also works closely with the Social Security Administration and the Railroad Retirement Board. Okay, so the parts of Medicare. There are four main parts. You have Part A, B, C, and D. I'll explain what each covers and how they work together. There are two ways of getting Medicare. On the left is the original Medicare with parts A and B, which you can add supplemental to, as well as a standalone prescription drug coverage plan. On the right is Medicare Advantage or Part C. Advantage combines Part A and B and usually has D coverage for your prescriptions. However, some Advantage plans do not include Part D, which you could always add a standalone drug plan. Who qualifies for Part A and B? As we said earlier, people over the age of 65 qualify, as well as people under 65 who are disabled. When you qualify with a disability, you must have been receiving disability benefits for 2 years. People with end stage renal disease or ALS also qualify for Medicare. So, how do you enroll? If you're receiving Social Security or Railroad Retirement benefits, Medicare should automatically be added for you on the first day of the month that you turned 65. Now, if your birthday is on the first day of the month, Medicare will be effective on the first day of the prior month. And if you're disabled, your benefits will become effective on the 25th month of your disability. But if you're still working, you will need to sign up for Medicare through Social Security or the Railroad Retirement Board 3 months before turning 65. If you want to delay signing up because you have coverage through yours or your spouse's employer, make sure to check with your HR to verify that you have credible coverage. If you retire or lose group coverage and you need to get on Part B, be sure to do it as soon as possible. A delay could cause a 10% penalty for every 12 months that you were eligible but did not sign up. Something else to think about. If you're under your spouse's employer insurance, it's worth comparing Medicare rates against that. I say that because a lot of the times this can save you money, as adding a spouse to an employer plan is generally much more costly than the employee by themselves. Enrollment periods. The first enrollment period is IEP, or Initial Enrollment Period, which surrounds your 65th birthday month. It starts 3 months before you turn 65, includes your birth month, and the 3 months following. The second enrollment period is when you retire or lose group employer based coverage. That is called Special Enrollment Period and lasts for 8 months. The special enrollment period starts the month after you retire. And if you miss either of those, there's general election period every year, which starts January 1st and ends March 31st. When you enroll during the general election period, your Medicare policy would become effective on July 1st. Keep in mind that there is a 10% penalty for every 12 full month periods that you were eligible but did not enroll. Okay, so let's start with Part A. Some people think of A for admissions because it relates to hospital inpatient services. Part A is going to cover hospital, inpatient, rehab centers, skilled nursing facility, hospice, home health care, and blood. Long term care is not covered through Medicare. If you or your spouse paid FICA taxes for at least 10 years or 40 quarters while working, then there is no premium for Part A. Social Security holds onto that money that you paid in over time and then sends it to Medicare after you have signed up. If you did not pay in for 40 quarters, you still have the option to get Part A, but with a premium. In 2025, the premium can go up to $518 per month. Assistance is available for those with limited income, but typically Part A is $0 a month. Here's some of the costs associated with Part A. In 2025, the hospital deductible is $1,676 per benefit period. One benefit period equals 60 days. So, in a worst case scenario, there could be 6 benefit periods in 1 year. Let's say you had a really challenging health year and you're in the hospital for over 60 days. You would also have copays of $419 per day. Now, what happens if you're in the hospital for 90 or more days? Your daily cost goes up to $838 per day, and you use your lifetime reserve days. Well, what are lifetime reserve days? In original Medicare, these are additional days that Medicare will pay for when you're in the hospital for more than 90 days. You have a total of 60 reserve days that can be used during your lifetime. For each lifetime reserve day, Medicare pays all covered costs except for your daily coinsurance of $838. Once you've surpassed your 60 lifetime reserve days, Medicare pays nothing. Unfortunately, there's no ceiling to what you could owe out of pocket. Part A is also going to cover skilled nursing for up to 20 days with a $0 copay or coinsurance. After 21 days, however, you will have to pay $209.50 coinsurance for each day up until 100 days. After the 101st day, you are then responsible for all costs. Short term care, as in home health care services like skilled nursing services, physical therapy, and speech therapy, well, these costs are covered as well. Hospice care is covered, but you are responsible for $5 copays for prescription drugs and other similar products used for pain relief, as well as 5% for respite care. Next up is Part B, which is for medical services. Part B is going to cover things like doctor services, outpatient care, home health services, preventative care, durable medical equipment, as in wheelchairs or walkers, and different outpatient items. In 2025, several new coverage items were added. For example, expanded mental health care, additional caregiver support, the Postal Service Health Benefits Program, changes to telehealth coverage, and out of pocket drug costs are capped at $2,000. In 2025, the Part B premium that most people pay is $185 per month. Those with higher incomes could pay up to $628.90 per month. The premium is based on income that you reported to the IRS 2 years prior to applying to Medicare. So, if you're starting your Part B in 2025, the IRS will be looking at your income from 2023. Something else to note is that they look at all of your income. If you're deducting money from a retirement account, be aware of the income stages, as people have drawn out a couple thousands of dollars for a child to borrow, for example, only to find out that they were bumped into a higher bracket, which then cost them more for their Part B premium. People with a limited income who receive financial assistance will have a $0 premium. Again, there is a 10% penalty for every 12 months that you were eligible but did not sign up. There are additional costs to Part B. The annual deductible is $257 for 2025. After that, it works like an 80/20 plan where Medicare pays 80% and you're responsible for the other 20%. With Medicare only, there's no ceiling to the amount that you could owe out of pocket. As you can tell, Medicare does not cover all costs. And if you're like me, you can't afford those high copayments and financial risks. That's why it's important to add additional coverage. Medicare supplements are one way to get additional coverage. Also called Medigap plans, it's additional health insurance that covers some or most of the costs that Medicare doesn't cover. These would be things like co-pays, co-insurance, and deductibles. This is also provided by private health companies. Medicare regulates the plans and creates a standardization of plans. That way you can compare apples to apples and see how they stack up next to each other. And this is what it looks like when the plans are side by side. They use letters again, which makes things a little confusing sometimes. Notice these are plans ABC, not parts ABC. Until recently, Plan F has been popular because it covers all of the gaps. But starting on January 1st, 2020, people who became eligible for Medicare after that date do not have access to Plan C or F. If you were eligible prior to January 1st, 2020, you can still get a Plan F or keep your Plan F. Today, the popular Medicare supplement is Plan G, which covers everything except the Part B deductible of $257. I personally prefer Plan G over F because even with a $257 deductible, you'll still be saving quite a bit of money. Plan N is also becoming more popular because of the lower premium. Ultimately, the lower the premium, the more you pitch in. Alternatively, if you have a higher premium, you don't have to worry about shelling out more money during the year. The monthly premiums for Medicare supplements are usually around $100 a month for people turning 65. Your monthly premium is paid to the insurance company, and you do still need to continue to pay the government for your Part B, as the supplement is in addition to your original Medicare. Medicare supplement premiums vary by insurance carriers and depend on the plan that you choose, where you're located, and how old you are. The premiums go up over time as you age. Since the cost can vary between companies for the exact same coverage, Medigap policies can be compared side by side. Medical underwriting is usually required if you need to change plans. Your open enrollment period starts on your 65th birthday and lasts for 6 months, as long as you are enrolled in original Part A and B. If you delay enrolling in Part B because you have group health coverage, your open enrollment won't start until you sign up for Part B. During open enrollment, you have a guaranteed issue privilege, meaning that there's no health underwriting and you cannot be denied coverage or charged more due to health conditions. Medigap plans are not perfect. They do not cover long term care, dental, vision, or hearing, or private duty nursing. Most do not cover prescription drugs, so you'll likely need a standalone plan. So, original Medicare with a Medicare supplement and a separate prescription drug plan is one option. Let's discuss Medicare Advantage, which usually includes Part D to cover your prescriptions. Part C, also known as Medicare Advantage. Think C for company. These plans are provided by independent insurance companies. Insurance carriers who offer Medicare Advantage plans are contracted with Medicare. The insurance company pays the claim rather than the government. Medicare still approves the plan, and the plans can change each year. Plans must cover everything that Medicare covers, and they may include additional benefits, which varies. Most of the plans include prescription drug coverage. With Medicare Advantage plans, you still pay your Part B premium to the government, and you may have an additional monthly premium in addition to deductibles, copays, and co-insurance. The premiums and deductibles are low and often zero, and you will have an annual max out of pocket amount. You also have care coordination among your doctors for safer and more effective care. There's also additional supplemental benefits that are often included in the plans. The best part, you have a 12-month trial right, which allows you to try a Medicare Advantage plan for the first time for a period of 1 to 12 months and then switch back to a Medicare supplement with a guaranteed issue. There are different types of Medicare Advantage plans. HMO, as you know, requires you to stay in network to get benefits as well as require a referral to see specialists. With PPOs, you save money by staying in network, but you have the option to go out of network as well. When you go out of network, you just pay more out of pocket. Private fee for service plans let you see any doctor as long as they accept the terms and conditions, which can change from day to day, so you do have to check each time. Special needs plans are designed for people with chronic illnesses or people who also have Medicaid. Medicare Advantage only plans do not have drug coverage, but they do work well for veterans who get their medications through the VA. So, who is eligible for Medicare Advantage plans? You need to have Medicare Part A and B, as well as live in the plan service area. But the best part is you can join Advantage even if you have a pre existing condition, which also means no medical underwriting. And since 2021, people who have end stage renal disease can enroll and make plan changes during the annual election. You can only have one Medicare Advantage plan at a time, meaning you cannot have a Medicare supplement and a Medicare Advantage plan at the same time. Part D covers prescription drugs. That's an easy one to remember as D for drugs. These plans are also known as PDPs for prescription drug plans. They are also run by private insurance companies and approved by Medicare. You can get standalone coverage or have it built into your Medicare Advantage plan. Keep in mind that prescription drug plans do change annually. Eligibility for Part D is that you must have Part A and or Part B, live in the planned service area, and you have to stay enrolled in a plan to keep Part D. The premiums for Part D can vary by plan. We've seen them as low as $0 a month and go up to $155 per month. The IRS will determine if you pay an income related monthly adjustment. If your income is above a certain limit, these additional costs can range between $13.70 a month to $85.80 per month. There is a late enrollment penalty for Part D. If you go without credible coverage for 63 continuous days or more after your initial enrollment period is over, there's a penalty of 1% of the national base beneficiary premium for each month that you did not enroll. This penalty lasts for as long as you have Part D, which is why it's so important to make sure you sign up as soon as you are eligible. Extra help is available for those with limited income to pay for all or a portion of the late enrollment penalty, premiums, deductibles, and copays. Part D costs vary by plan. Each plan has their own formulary, and in that formulary, the drugs are placed in tiers from different levels of generic drugs to brand name drugs. In 2021, the senior savings model was introduced and created a $35 monthly cap on copays for certain types of insulin, which is available with certain participating plans. Part D may include a monthly premium unless it's included in the Medicare Advantage plan and could have an annual deductible which ranges from $0 to $590. Once that deductible has been met, you go into your initial coverage phase. Once you're in that phase, you pay a copayment or coinsurance for each prescription that you fill until your total drug costs reach $2,000. Once you've reached your $2,000, you will no longer pay a copayment or coinsurance for the rest of the calendar year. These are the enrollment periods that you need to be aware of for Part C and D. The initial election period, which is the 3 months before your 65th birthday, your birthday month, and the 3 months following. The annual enrollment period, which is every year from October 15th to December 7th. During this time, you can shop around and pick a Medicare Advantage plan or a standalone prescription drug plan. The plan that you choose before December 7th will take effect on January 1st. Now, let's say January 1st rolls around and you're not happy about the plan that you chose. During the open enrollment period, you can make a plan change by either switching from one Medicare Advantage plan to another or to a standalone prescription drug plan. The last enrollment period is the special enrollment period, which allows you to make changes due to a qualifying reason, such as change of residence, loss of group coverage, maybe your plan leaves the market for the upcoming year. There could be a new 5-star plan available that you want to try out, or if you have extra help or Medicaid. Now let's do a final comparison. There are two ways to get Medicare. On the left, we talked about original Medicare with Part A, which is usually a $0 premium, and Part B with a premium of $185 a month. You can add drug coverage, which can range from $8 and up. You can also add a Medicare supplement for around $100 a month. Or this second option on the right is our Medicare Advantage plan, also known as Part C. Part C combines Parts A, B, and usually D to include your prescriptions. The premiums are low and sometimes zero. Medicare Advantage plans can also include additional supplemental benefits like dental, vision, and hearing. So we've gone over Medicare basics, but we need to look at the entire picture now. One of the biggest concerns today for seniors, especially if they are on a fixed income, is the out-of-pocket expenses for healthcare. There are affordable ways to help protect you against some of the financial exposures. Being hospitalized can get expensive quickly, and you are responsible for paying the amounts not covered by Medicare or Medicare Advantage. A hospital indemnity plan covers some of the costs associated with the hospital stay and may provide extra coverage that your health plan doesn't. Dental, vision, or hearing is not covered by a basic Medicare. You can get a plan with one low premium. And have you thought about final expenses? Planning for final arrangements and funerals can get quite expensive. Nobody wants to leave their loved ones stressing over how to pay for that. That problem can be easily taken care of with final expense life insurance. With the final expense life insurance policy, you are able to provide a safety net for your loved ones to cover burial and funeral costs. Maybe even leave a little extra money that would be tax free for your beneficiaries. Long term coverage is something to think about as well. Neither original Medicare, Medicare supplements, or Medicare Advantage cover for long term care. Because there's so many things to consider, it's best to have an insurance broker available to you like myself. I represent many insurance companies and I can look at your prescriptions, doctors, and specific needs to determine the best plan option for you. I'm paid by the insurance companies that I represent, so there's never any cost to you for my services. Medicare is complicated and can be confusing, which is why I'm always happy to help. We can meet by phone, virtually, or in person. You can also reach me by text anytime and I will always respond. Please make sure to write down my contact information or take a picture with your phone. That way you have it readily available in case you think of any questions in the future. Don't hesitate to reach out as I love my job and I am here for you. Thanks so much.